For specific questions and queries that you may have. I would just like to add that, rising incidence of foodborne illnesses and diet-related disorders is something that is now being discussed globally. Foodborne illnesses together are a bigger public health concern than TB, malaria, and HIV/AIDS taken together. Though we tend to overlook them and push them under the carpet, but its economic and social consequences are immense for foodborne illnesses. And if we include the diet-related disorders, the unhealthy food that we have, then the consequences are far, far bigger. The rising incidence of, non-communicable diseases, rising childhood obesity, they are concerns that are facing us, facing us in India and facing the rest of the world. So it is now established that making changes in your diet, eating right, eating light, eating light is important. Eating right is important and eating light is important. Having a little less than what you want to have, is best way to maintain good health. And that is the principle on which Eat Right India is founded. It is based on 3 pillars. First is safe food. How do we address foodborne illnesses arising from food adulteration, contaminants that come in the supply chain? So how do we address these issues of foodborne illnesses? Second are diet-related disorders, which are about lack of micronutrients in our diets, having bad, avoiding certain kind of food. Trans fat, industrial trans fat is one area which is an area of concern and which the India wishes to eliminate by 2022 in the next few years. And this requires both a regulatory approach and also awareness building and capacity building approach. Third element of Eat Healthy is about avoiding or reducing consumption of certain kind of foods that have high salt, sugar and saturated fats. So this is the second leg or second pillar of the Eat Right India movement. Third pillar is interesting, and this is a new addition in consonance with what is happening globally of looking at food from an environment perspective, from an ecological perspective, and that brings us to that, how do we encourage food that is eaten locally and seasonally, because that will have less carbon footprint. How do we ensure that less food is wasted? How do we ensure that in food packaging we use less of plastics that have environmental concerns? So how do we conserve water in food production? How do we use less chemicals in food production? So these are issues of sustainability that are under the agenda for Eat Right India. We work with a wide range of partners, with the state governments, with district authorities. We also work with a range of ministries and departments at the national level and agencies at the national level.
Formalin in fish or the MSG, the impact of MSG, things like this which you have already talked about, that you need to check back with the regulator and the scientific personnel on what the actual facts are. You put in a balanced article, that is all right. But when you take a story and you put it out, it does a lot of harm to consumers also. And a lot of effort is going into making sure that food is safe and that we continuously work on this. So I would request also, in addition to what CEO has said, that we should be very careful. Make sure that we are checking back with a technical person, may not be the regulator, but you will find scientists, you will find government research institutions where people are working on these subjects. They would all be able to give factual picture on this. On social media, unfortunately, it's a much harder job. There were some stories on contamination of milk which were we gave out detailed press notes, we gave out detailed technical rebuttals, and 2 years later the same lot again started circulating on WhatsApp. So this requires us all to be alert as consumers and as stakeholders.